This video combines 3 of my favorite self-care techniques for pain and tension due to normal wear and tear. The links below provide more information on the techniques we are using, which are all simple but rooted deep in physiology. Today I want to quickly introduce them and demonstrate how easy they are to use together to find relief from everyday pain and tension. Interestingly, the key to success with all 3 is body awareness and moving away from pain and into comfort. Combining all 3 is a triple treat for your nervous system, providing relief, nutrients, and stimulation so it can reorganize movement and reduce discomfort. Dermoneuromodulating, or DNM, is a deceptively simple manual therapy approach that I find very effective for addressing pain. It is based on modern pain and neuroscience concepts, but boils down to the simple technique of holding stretched skin in positions that provide you relief. The key is awareness of your sensations and exploring different holds to find what works best for you. We'll also be using somatics to help reduce tension in our muscles through movements. Somatic movements are slow, mindful movements requiring awareness, exploring sensations during easy, repetitive movements. We stay aware, explore slowly, and don't move through pain or excessive tension. While breathing is normally automatic, we're going to explicitly grab control of our breathing in a way that alters the chemistry of our body using the Wim Hof breathing technique. This simple but powerful approach consists of about 30 fast, deep breaths, followed by a breath hold on the last exhalation. Once we feel we need a breath, we inhale and hold that breath for about 10 seconds before repeating or resuming normal breathing. You can feel the changes due to increased oxygen and decreased wastes. Don't worry about multitasking, as our awareness will be focused on a single technique at any instant. You should feel safe and in control at all times. Additionally, you should feel free to explore what works best for you in the moment, using these techniques as a starting place for suggestions and guidance. This video is only an example showing possibilities. I'm pretty tough on my body, and it normally shows up as excessive right side tension, especially in my lateral trunk flexors and leading into my hip. I normally end up with muscular pain in the sacral region, but sometimes also in the hip flexors. I used to grind into the muscles with a hard ball or roller, but the technique was painful and rapidly devolved to chasing pain. I have since evolved and find using this triple thread of dermoneuromodulation, somatic movement, and breathing reduces pain and tension rapidly and effectively. Continuing the state of heightened body awareness after the session into normal movements often allows me to identify technique issues causing the pain and tension in the first place. My right obliques appear quite tight today, so I'll begin by choosing an appropriate position, preferably sideline or a modified supine, because they release tension on the target nerves. Today I'll use sideline. I played with various bolster arrangements between my legs and under my torso and decided today I'm just going to use a headrest. The key is to get comfortable and don't be afraid to change. I'll initiate the session by using DNM, broadly targeting the lateral cutaneous nerves of the trunk, but I'm guided by how I feel as I apply each hold. This process can take a while when working with a client, but is quick when working on yourself. Rest your hand on the tissue and let it engage the skin. Then explore different directions of light stretch. When I find a good spot, I generally feel a subtle reduction in tension and pain, along with a feeling of the tissue being able to breathe, if that makes sense. I'll hold that position until the feeling stabilizes, and then introduce small somatic movements. Since most of my issues show up around my sacrum, I decided to slowly glide my upper leg over my lower, causing my pelvis to move forward and back. I do this movement while maintaining the DNM hold, and if I notice an interesting sensation, I'll stop and explore it for a while. Once I've found a comfortable position that seems to be working, I might add some breathing using Wim Hof's protocol of about 30 quick, deep breaths with a breath hold on the last exhale. When I need to breathe again, I take a single deep inhalation and hold that for about 10 seconds before repeating or resuming normal breathing. Often I'll experience a sensation of tingling in the trouble area during or after the exercise and breathe into that spot. Sometimes breathing into the area is literally possible, like the abdominal area I'm working today, and other times it is more of an intention or visualization. Either way, the goal is to focus on delivering nutrients and removing wastes from the target area. A typical session might last 5 minutes to an hour or more. I maintain each DNM hold about 30 seconds up to several minutes. The somatic movements have about the same timing, but sometimes I'll go longer. I typically throw in 3 to 5 breathing cycles, but that can go much higher also. There's one more important component to add. Occasionally rest in complete stillness and monitor your body to help direct where you go next. I find if I set my goal to just take some time to listen to my body and follow my intuition, I'll typically leave the session feeling lighter and moving easier with reduced pain and tension. However, if I set my goal to reduce pain and tension in 5 minutes or less, I have a much greater likelihood of being disappointed. Please use the resources in the links below to expand your self-care toolkit and give yourself permission to take the time to explore. Feel free to contact us if you need more help. Have fun and be well. PAMPER is an enjoyable and effective way to improve movement quality. If you are constantly tight, sore, or injured, you may want to pamper yourself. Are you ready to learn more? Then check out the links below or some of our other videos. Thanks for watching.